Welcome back to Market Urban. With me to do a discussion is Kwesi Entry, Healthcare Systems and Governmental Affairs, lead of Zipline. Kwesi, welcome.
Thank you.
Good to have you in the studio.
Great to see you too.
Fantastic. Now, Kwesi, before we set the conversation rolling, I want us to take a story of Zipline, or where we've seen Zipline carry women along in the technology field. So we go for that story. We'll come back. We'll look at what we have for today. The Zipline distribution system was linked up for government hospital. Today I'm told by these wonderful ladies who are driving this technology. What about 8 hospitals? Amazing. Samanka Security is very close to my home. The Zipline distribution center is categorized into 3. That is the fulfillment center, the flight operations center, and the control center. Basically, this company is here to complement the efforts of government in bringing health services to the doorsteps of patients in hospitals. The story aims at looking at the direct job it has provided and the role of young Ghanaian women are playing, using drones to bring over 140 essential drugs and blood to the sick. Out of the 18 employees, 10 are women with engineering and biochemist background. Besides, there are 8 people who are from the Minako Township, including Mary Dansua and Elizabeth Amuzu. Yeah. Elizabeth Amuzu is responsible for the cleaning of the distribution center. Prior to getting employment in this company, she used to work as a community health assistant on the ticket of the National Youth Employment Agency. Another young lady from the community working here is Mary Dansua.
I used to sell things, but I carried them out to other towns and bit. But through this work, I've been, making some money to my container so that I can have my shop.
Mary's day starts at 8 in the morning and ends at 5 in the evening. The role of Mary in the chain of work at Zipline is to ensure that boxes carrying the essential drugs and blood for onward distribution to hospitals are in good shape and can absorb any shock when the pack is dropped by the drones.
Then we make our books.
Mary's end, I went to the flight operations center and I met Georgina Wilson. She's one of the female flight operators at Zipline. Georgina says her drive into the engineering space started in her childhood days. I used to ask her father questions about how things work.
As a kid, I always loved to understand how things worked. So when my dad puts on the light, like, how did the lights happen? How did the lights happen? So these questions, I had to find them on my own. And I think that's what has helped me.
She was among the first group of Ghanaians to be sent to Rwanda to be trained in using drones to deliver medical supplies to save lives. Welcome back. Akwesi, that was women that you've gotten on board Zipline train, and they are driving the market in Ghana. Yeah. Now, at the moment, how would you describe the drone delivery market in Ghana?
Well, the delivery market in Ghana is, from our perspective, is largely based on the distribution of healthcare commodities. So, with Zipline coming on board and in the integration of area logistics into the current logistics systems put in place by the ministry, we are looking at leveraging area logistics and its benefits in helping to optimize supply chain.
Wonderful. Great. So, you've been in the system for a while. 2019?
Yeah, April 2019.
How many centers have you built so far?
So we have 4 distribution centers, one in the eastern region, one in the western north region, one in the northeast region, but covering a good part of the northern region. And the last one in the Ashanti region. And we are looking at adding 4 more distribution centers going forward. In fact, by the end of this year, we'll be adding 2 more distribution centers, one in Enum and one in the Uti region. And they'll be catering for island communities, riverine communities, and hard-to-reach areas. The Afran Plains area, the Volta region, and also the Uti region.
Wow. Let's impact you've made in terms of job creation so far, 2 years down the line?
Yeah, so I like the documentary that you just showed. So in terms of job creation, I mean, we have 4 distribution centers, and we have people within the fulfillment operations area and the flight operations area. So just that helps us to employ people from the engineering field, people from the pharmacy field, and people with the knowledge on supply chain systems. Each distribution center would have roughly like 50 operators. So taking into consideration for distribution centers, you are looking at 200 distribution centers. And one thing that I'm happy to tell you is that 50 to 60% of these people are actually women, young people. Wow. And in fact, our general manager, the general manager for Zipline herself is a woman. So it just speaks volumes about how important we consider women empowerment when it comes to our operations as Zipline.
So what about the local guys that have the catchment area?
Yeah. So beyond that, we also have a local hiring policy. So all of our support staff are employed from the areas that we find our distribution centers. So when you go to Eastern Region or Menako, our drivers, our cleaners, as you showed in the documentary, workers who help us with building our package systems, they are all within the communities that we find ourselves in. We employ people from there. And we also try to also make sure that all the vendors we use at our distribution centers are picked from the community. So that helps to boost the local economies of the areas that we find ourselves in.
Now, let's look at COVID.
Yeah.
Has hit us hard. How do you come in? What have you been doing so far as Ghana was hit with COVID?
So that's a very, very good question. So what we are doing now is support the Ghana Health Service. We are working with the Ghana Health Service and the Ministry of Health to help in the distribution of COVID vaccines to hard-to-reach areas. And the impact has been tremendous. We are seeing hard-to-reach areas and rural areas getting their fair share of the COVID vaccines that we are receiving. Just yesterday or last 2 days, we distributed a number of vaccines to their front planes. We are seeing regions that were newly created getting their fair share. Western North region, which has one of our distribution center, is serving as, Zipline there is serving as a sole distributor of COVID vaccines and indeed other routine vaccines within the region. So from our distribution center, we are delivering COVID vaccines to facilities within 8 of the 9 districts of the Western North region. We are also helping to support facilities at the rural level without storage capacity or storage systems to store vaccines in bulk to get instant supplies of COVID vaccines so that we do not have a lot of waste in the system already. You know that we are not having so much vaccines. So it is important and critical for us to put systems in place for that to be managed. Lastly, in terms of impact, we've also helped to support disaster-stricken areas. So when you talk about the north where we are seeing floods, and floods as a result of the Bagre Dam spillage and the rains that are occurring there, we are also supporting some districts within the northern region with the distribution of COVID vaccines, because during this time we find out that most of the areas or roads leading to these areas are cut off. So it is very difficult for health workers to come to the regional capitals to pick up vaccines. So the more viable option is for drones to deliver these vaccines to these facilities for patients and indeed Ghanaians there to also be vaccinated. So a drone system, like I mentioned earlier on, has come to stay, and it's also helping us to optimize our supply chain systems and to handle some of the unforeseen circumstances that we normally come across within our healthcare sector management.
So let's look at when you started the kind of job you're doing, the core thing you were doing in terms of medical deliveries. A typical, let's say, I remember you had one at Tafo also area, Amenako that was serving Tafo Hospital. In a normal day, just get a picture, if a vehicle is transporting maybe blood from one point to another point, how much will it cost and what has been the savings made so far in using drones to deliver essential services? Okay,
so let me give you a typical example. So when we started our operations, we started with the medical products, but when COVID struck, we moved into the distribution of COVID samples. So we distribute COVID samples from our centers in the Eastern and the Ashanti region to Noguchi in Accra and the Kumasi Center for Collaborative Research at KNUST. So speaking to one of the directors at the healthcare level in the Eastern region area, they told us that in a month or in a day, they could spend like 500 cedis fueling their cars to pick up vaccines from the region to Accra, to Noguchi. But with Zipline services coming on board, they haven't spent that much for a very long time, because all they have to do is to send the vaccines, send the samples to our center, then we fly in a matter of 30 minutes to Noguchi. So that's, I mean, a very good pictorial understanding of how we've helped to cut some of the costs in the healthcare system.
So looking at Zipline, we're told that your operations is the biggest in the world in terms of drone delivery of medical essentials. Is that the case?
Yes. So currently with our 4 distribution centers, we are covering 40–50% of the country. But there are some other areas that have been left out. Upper West, I mean, the OT area has a lot of islands, a lot of hard-to-reach areas. Volta region, mountainous areas, riverine communities and islands along the lake. Same with Afam Plains. We all know the story about Afam Plains. So with our next 2 distribution centers coming on board, we are going to focus on Afam Plains. We are going to focus on Volta region. 80% of Volta region will be covered. The entire OT region, together with its riverine areas and island communities, will also be catered for. Next year, we would have time to also add on 2 more distribution centers, and we are hoping to site 1 in the Upper West region. The last one, we are looking at an area within the Middle Belt.
So let's look at the issue of the challenges you have so far encountered in doing all this work. What are some of the challenges and you managed to scale about that?
Well, I think you know, our service is a very new one, so it is very difficult for people to appreciate. And so, I mean, coming to Ghana, we're very fortunate to have the Ministry of Health and the Ghana Health Service to embrace the technology. So, you know, some of those, should I say, challenges on the ground weren't faced that much, because we work with the Ghana Health Service to build an SOP to help integrate us into the Ghana Health System, you know, logistics supply chain system. So as I speak, we have a standard operating procedure for just-in-time drone delivery. We are probably the only country in the world with that kind of, you know, SOP, and it has helped us. It has helped us to surmount some of the challenges which we would have faced had we not put that system in place. So, even though we face some challenges here and there, I think to a very good extent, the Ghana Health Service and the Ministry of Health has embraced the technology and has pushed for us to be well integrated into the system. So it's a fortunate thing that we've had on us.
So far, I know you started in Rwanda, and now in Ghana. Is there any other African country that is you're trying to push your frontiers to?
So Ghana and Rwanda have been very good examples to the rest of the world. So you are looking at launching in Kaduna and Cross River State in Nigeria in the coming months. There are some other countries that are still considering the integration of aerial logistics into their supply chain system. Outside Africa, there's Japan, there are some other countries that we are also pursuing, and even the US. It's very interesting that Ghana has become an early adopter of a technology, you know, even before the US. So we are looking at launching operations as it is here in Ghana in the US. So those are some of the countries that we are looking at currently.
Let's look at technology transfer. How has your system helped in building our technological base in terms of human capital?
It has helped, because going back to the point about job creation, we are employing a lot of young people, and I mean, we all know how jobs are becoming obsolete. Most of the jobs around are either becoming obsolete or are being automated. So it has become more critical for, I mean, young people to build skills in other areas outside what we know right now. And Zipline coming on board has helped to do exactly this. I mean, we have engineers building batteries, we have engineers learning how to, you know, build drones and all. In fact, when COVID struck, we were supposed to set up our distribution center in Western North region. And before that, we would usually have, I mean, our colleagues in the US come to assist us in building up that distribution center. But because we had built people within our country to do that, the Western North Distribution Center was entirely built by Ghanaians. I'm talking about 24, 25-year-olds. Even for me as a Zipline worker, when I got there and I saw what they had done, I was surprised myself. So it just talks to some of, you know, the soft benefits of Zipline that we sometimes overlook.
The world is moving towards AI, like you say.
Yeah.
So how is this helping us to position ourselves not to be left behind?
Yes. So we are constantly improving our services, and given that we are moving into an area of artificial intelligence, it's par for the course that would we would always, consider that in the future. But we are constantly improving our services. I can give you an example. When we started our operations, our software version was, I think, 1.0 or so. As I speak, we are in a 30th version or so.
Wow.
So we are constantly improving our systems, and it's just a matter of time. Artificial intelligence will be incorporated so that we are able to render a better service and also able to respond to the needs of the market.
Now, the Bagri Dam is yet to be spilled.
Yeah.
You talked briefly about that.
Yeah.
I think you did that last year.
Yes, we did that last year. We supported, I think, West Mampusi district and also Mampusi Magduri districts within the northeast regions. I think those areas are the flood-prone areas of the northern regions, together with some other districts within the upper east region. Interestingly, during this time of the year in the north, you also see spikes of malaria cases. So for these areas that are cut off from the rest of the region, it means that they would have to, just hold on for months and weeks for the rains to recede before they are able to get medications for treating malaria and the likes. But with Zipline on board, at least last year, we were able to deliver anti-malarials and antipyretics to these areas to help, hold the fort until, the rains receded and the roads were dry for the RMS to send in their stocks. And we are planning to do same this year. We are going to support them with the delivery of medical products in general. And I know NADMO is also in discussions with us to also help us support, deliver some relief items to the area if need be.
Oh, you do delivery of relief items?
So that's how fast our service has evolved.
Wow.
People from other areas are now seeing, the impacts of aerial logistics and are now getting, what the benefits are when it comes to aerial logistics. So we've had a number of partners here and there approaching us to support them when it comes to distribution of all kinds of products. So far, if you look at the deliveries you've made, both
vaccine, samples, and medications, you have figures to support that?
Yes, we've delivered 950,000 units of products through 105,000 deliveries.
Wow.
And out of the 950,000 units of products, we are talking about 600,000 being medical products and around 300,000 being vaccines. In fact, for vaccines, routine vaccines, we've delivered over 2.5 million doses of routine vaccines. These are vaccines that were used in immunization of children, tetanus, polio, whooping cough, those diseases that we are very conversant with. So in terms of deliveries, we've done quite a number, and we are looking to doing more, given that to be adding on more distribution centers, and we'll be 7 areas that actually now need our services more. So it's just, the number is going to grow.
Great. So the areas that you operate in the communities, how is there a policy that, because I think last time I came to, there was children or the locals who brought there to understudy or to just have an excursion to look at what's happening. Yeah. Are you doing that, more of that? Or? We
are doing a lot of that, and I'll use your platform to also invite churches, schools, anyone interested in our service to invite our distribution center. So currently what we do is that we invite children from schools. We've had prime time visit our distribution centers. We've had people from Brilliant Science and Maths Quiz visit our distribution centers. We've had people, churches, visit our distribution centers. And for kids particularly, it's an opportunity for them to, get to see the potential of aerial logistics and what it means for them in the future. So for kids, just that exposure helps them to inspire, to aspire to become, something big within the technological space. So it's a big thing for us, and like I said, given that our service is very difficult to imagine, I'll use this opportunity to invite anyone who's interested in our business and in our model to come visit our distribution center.
So going forward, how do we see the drone delivery market in Ghana with you taking the lead?
So we are going to see more of drones deliver products that typically were not being delivered. So we started with blood products, medical products, and vaccines. Now we are delivering COVID vaccines. Now we are delivering COVID samples. We are delivering body ulcer samples. We are delivering other samples of public health importance. And I mean, given the pace and the rate of evolution of the aerial logistics service, I won't be surprised if you see drones delivering, I mean, food or some other items of a confectionery nature in the next few years to come. But I guess we just have to keep our fingers crossed.
So how do you see Ghana in this space going forward next 5 years, next 10 years? I
see Ghana as a leader in the space, because we are one of the early adopters of the technology. And frankly speaking, if the line should launch its operations anywhere in the world, I can say 50% or 60% of the operators that will be sent to operationalize these distribution centers will be Ghanaians. I've already shared a story about Ghanaians and young people setting up our distribution center in Western North. So, I mean, I can only see Ghana being one of the leading countries within this particular space. And it's, like I said, one of the soft benefits of this, if you have the opportunity to equip young people with skills that will be needed in the future, it gives you, you know, some form of mileage as far as, you know, job creation is concerned in the future. Because like I said, most of these jobs that, I mean, banks and all that,